Patient detected with bladder cancer can have two types. One is superficial or the deep type. So let us call them type 1 and type 2. Superficial type 1 bladder cancer, this is treated without removing the entire bladder. It is treated by removing only the tumor by endoscopic means, which means by removing the tumor by telescopic surgery from the bladder. As far as the deep type, the type 2 bladder cancer is concerned, that can create life-threatening issues for the patient if it is not treated by removing the complete bladder. So the entire bladder has to be removed. So this is an issue where the patient has to be counseled and he has to be taught that he will have a new way of passing urine for the rest of his life. There are two different kinds of treatments for bladder cancer. After the complete removal of bladder, the patient has to understand that he will have a new normal for his life, and he will need to cope up where the urine passage will be very different. So option 1, the patient can have an external device which is stuck onto his abdomen where the urine comes out and gets collected continuously. Second option, there can be a hole made by the surgeon from where the urine comes out, but for getting the urine out, the patient may have to pass a tube. And the third and the best option for the patient is that the surgeon can create a new bladder from the small intestine or sometimes from even the large intestine, which is replaced in the same position where the original bladder was, and the kidney with its ureter will deposit the urine back into this new bladder, and the patient can pass urine as if he was normal. So the third technique, which is very patient friendly, very user friendly, is what is generally preferred by the patient. Let me be clear in terms that the new bladder is a technical operation. It is a highly skilled operation. I am happy to offer these services through the NMC Eurocare specialty at our center in Abu Dhabi. As we discussed that we have to remove the entire bladder in cases where there is deep a type of bladder cancer, and then we have to teach the patient newer things and newer ways of passing urine. So this is a problematic situation, and there are patients who run away from this kind of treatment. But there are ways where these problems can be solved by counseling and training by using the earlier patients. So if a patient has a device he is using, he is comfortable with, he can teach our other patients, he can teach other patients how to use and get used to that device. And it takes roughly around 2 to 3 months. It is a high consequence surgery. The patient has to cope up with that. The family also can help. And that is why the more modern surgery or more newer surgery where we replace the bladder with the intestinal substitute is many times more preferred. But one has to keep in mind that if the person is not able to pass urine with that, or he is not able to manage it, then he has to go back to some other way of the urine coming out, because ultimately the target is to make the urine come out in the most comfortable way that the patient feels without any scientific complications.